Hi, my name is Laura Dockapil, and I'm currently a nurse practitioner student in the primary care setting, but I'm also a licensed professional counselor and have been doing that since 2010. The reason I'm making this video is to hopefully help you as a primary care provider to have kind of an arsenal of some therapeutic tools that you can implement in a timely manner in your practice, as I am very aware that we're seeing a lot more mental health coming through, especially in the younger kids and teen areas, coming through those primary care clinics. And sometimes the resources for mental health are just completely overwhelmed, and you're having these people have to wait months to get some therapy. So these are kind of some interventions that I want to show you that are A, very effective, B, you don't have to be a therapist to implement them, and C, will kind of give your patients something that they can use right then and there, and that they can use until they are able to get into a professional mental health provider. The first one I'm going to go over with you is specifically for depression, and I'm going to show you two interventions for depression. The first one is really easy, and I totally understand that in the primary care clinic setting, it is very important to stay on time with your patients. You don't have much time to spend with them, and inevitably, visits that are not categorized as psychiatric visits, as far as the chief complaint, but then turn into that, I promise you that the interventions I'm going to show you actually will get you out of those visits quicker, because it provides something that your patient can do right then and there in the room and that they can take out with them. And secondly, it adds a way to wrap up that visit in a nice manner. So the first one I'm going to go over is for depression. This could really be used on ages, you could use it ages 5 to 105, okay? It's for depression. It's called 3 Good Things. And basically, in depression, part of the reason that people are depressed, they can get into this very negative mindset. And once one bad thing happens, then they kind of start thinking that the next thing is going to be bad. Whether it's neutral, good, bad, it doesn't matter. They can just totally think everything is going to be bad from then on out. So this 3 Good Things exercise is something you can teach them to kind of just shock their mind out of this negative constant process. So pretty much all you do is you say, okay, I want you to practice the 3 Good Things exercise. I just want you to name 3 good things right now that are going on in your life. And you can tell them, look, you could be really creative with it, like, oh, you know, I'm glad that I don't have scurvy. I'm glad that, or I'm happy that, you know, I made a good grade on my test. I'm happy that I am able to eat the food that I like later on today. It doesn't have to be just earth-shattering good things. But what this does is, first, it gets them to kind of have to think outside of this very negative kind of thought skew that they go into. And what it does is it brings them up out of that negative mindset. And once they start naming these 3 good things, inevitably the mind kind of starts to think of even more positive things after that. So does that cure their depression? Absolutely not. But it is kind of a negative thought process breaker. I use it in my own personal life whenever I feel like everything is just horrible and I can't think of anything good. You know what? I'll be sitting there driving in the car and I'm like, okay, 3 good things. And inevitably it does. It brings my mindset up. So that's a simple, easy, quick intervention that you can do with them in the office, that they can practice on their own until they can get into a therapist or whatever mental health professional they're needing. Okay, the next one for depression that I want to teach you this is a really good one specifically for my teenagers. Really love this one, but you could probably go down even to like 9 years old, and adults like this one too. What it is it's called a self-soothing kit. And the idea behind it is that this little kit is unique to everyone. You tell the patient, listen, you know, when you're feeling really depressed and down, sometimes it can be overwhelming. So what I want you to do for an assignment is I want you to go home and I want you to make yourself a self-soothing kit to kind of help yourself through those hard times. And what you're going to put in this kit, and it's unique to everybody, you need to have one little thing that you like to look at. It could be a picture, it could be a certain object, it could be a rock, something that like brings you happiness when you look at it, and you can put that as a part of the kit. The second thing you can have is something that is a good smell to you, okay? Like maybe it's chocolate, or maybe it's some kind of flowery perfume, but you can also put that in your kit. The third thing would be something that tastes good to you. Now, I will say this part of the kit has to be replaced a lot of times, because if you eat the thing that tastes good, well, okay, you're gonna need another one the next time you access the kit. But this could be like for me, I would probably do like one of those junior mints or something, or perhaps a peppermint, but something small that tastes good to you, okay? The next thing would be something that you like to hear, whether it be like a little bell, or just maybe it's a little fidget cube, or something, a clicking, or something simple, maybe a chime, something that, you know, makes you happy when you listen to it. And the last thing is something that you like to feel. This could be anything from, I've had patients do silly putty to a rabbit's foot, but the idea is that this patient will be able to kind of access this kit when they're feeling really stressed, you know, and this works for anxiety as well, but it's really kind of nice for depression in that it gives them something to work on, an assignment, which I can tell you as a primarily cognitive behavioral therapist geared, that's what I am. I believe in homework. I believe that to get the patient to do something and take a role in their healing process is important. So, and a lot of them, especially the teenagers, love the self-care kit. They could put it in something small. They don't have to buy anything. And what I would suggest is, if you're going to have them follow back up with you, even for antidepressants, go ahead and have them bring their self-care kit to you so they can show it to you, because a lot of them are really proud. They're going to tell you what it is. Again, this is a simple exercise. You can make one for yourself. But again, both the 3 Good Things and the self-soothing kit or self-care kit are kind of nice surface strategies that you as a clinician can use when you're trying to wrap up this this visit that's turned into a psych visit, or maybe it is a psych visit, okay? And then you can have them follow up with you next time. So I hope that's helpful for you in the category of depression.